So, remember, when looking down at the patient, the sides are flipped. So, looking down at the heart, imagine that you are a patient, so flip the sides. Their right is our left, their left is our right. So remember, whenever looking straight down at the anterior version, or anterior is front, the sides are flipped. And remember I told you earlier, at the right side of the heart, aka left from our view, but right side of the heart, that's mainly where deoxygenated blood goes into as it enters the superior vena cava and the inferior vena cava. And then the left side of the heart, this side down here, or all around here, that is where oxygenated blood goes into. And this right, let me get a darker one for you. This big structure right here, it goes descending down all the way to here. This is your aorta. This is just the upper aorta, or just, you can regularly call it the aorta, and right down here, that is your descending aorta. And then here you have your pulmonary veins, and here are your pulmonary arteries. Remember, it's not just left side, there are also pulmonary veins that should be around here, but I think they just weren't included in the model. Pulmonary, remember, pulmonary is lungs. Arteries, A for away. So you have your atrium, A for up, for your atrium, and then A for away for your arteries. So these right here, your pulmonary arteries, remember, pulmonary lungs, they take oxygen to the lungs. If we draw a lung right here and a lung right here, these lungs have all sort of capillaries in them, and these capillaries take deoxygenate these lungs like horrible, but these capillaries take deoxygenated blood and reoxygenate them. So when they're reoxygenated, these capillaries go into the pulmonary veins. So veins bring blood back. What? Yes, okay. So I was just remembering something real quick. So these veins bring blood back into the heart. This is specifically for the lungs, though. Okay, and then you have your aorta. Wait, is your? So let me do that. It is an artery. Okay, that's what I thought. A4 way. Wait, I was right. Yeah, no, I was just being dumb for a second. Don't listen to me. If it's red, that just means it's oxygenated. That doesn't mean it's bringing blood away to or to the heart. Artery is towards, vein is away. Just think of it like that. So the superior vena cava or inferior vena cava, they're just really thick veins. So don't get size mixed up. Don't get it bringing red mixed up. It's vein and artery. That's all that matters. So, as you can see, I need to check that myself. So, your aorta and the descending aorta, they're part of the same structure. Because they are aortas, remember, A4 way, they're going to take blood away from the heart. The upper part of the aorta will help supply the upper part of your body. So like your head, like maybe your arms and stuff. I don't know. Then your inferior will like get your legs and your lower torso. There you go. So that's the basics of just like labeling stuff, and I'll restart and just redo the entire. How do I do this? I don't know how to use this thing. There we go. Okay, so now I'll restart and I'll show you how blood moves through the body, so you can remind you just one more run through. You already told you. You got this. Okay, so we start from the. Telling you don't start. And I think if they're talking about starting, talk about the atrium, but blood first comes in from the superior and inferior vena cava. And from those vena cava, let me drop an arrow, they go into the right. Remember, it's flipped, so your left is your right. The right atrium. And from the right atrium, they go through, what is this? This is the tricuspid valve. So remember, this has the tricuspid valve, and from the tricuspid, let me make sure, tricuspid valve. The right atrium ventricle, making sure. See, I'm looking out for you. So, it goes through the tricuspid valve into the right ventricle, and this fills the ventricular space. And then when the ventricle contracts, it will travel through the pulmonary valve. Remember, pulmonary is lungs, so that means it's going into the lungs. Enter the pulmonary trunk. This is the trunk. Then go through the pulmonary arteries. So your pulmonary trunk's here, then it goes through your arteries here, if that's how you want to think of it. But overall, you could just think of this as the pulmonary artery in total, but if it makes you feel any better and you want to know what the trunk is, this kind of area is really the trunk. So then these pulmonary arteries will take, let me draw our lungs again, our beautiful lungs. They'll take it into the lungs. And here you have yablo. They'll take this deoxygenated blood and then reoxygenate it. So that means it's giving it oxygen. And these are specifically pulmonary capillaries. Capillaries are just very small blood vessels. So if you're wondering what a capillary is, that's just what it is. So we don't really need to know that. So after they've been oxygenated, this is when we're going to go into the pulmonary veins. So right here, then on this side, they'd be like around here. They're just, once again, I don't know, just not shown in the model. So they're going to go into your pulmonary artery, or veins. Veins. Do not, if I said arteries, don't listen to me. A for away, veins bring it back. So they're going to go into your pulmonary veins. Pulmonary veins. So pulmonary veins, pulmonary arteries. Arteries into the lungs, veins out of lungs. Arteries away from the heart, veins towards the heart. So after going into your pulmonary veins, they will enter the left atrium. From the left atrium, they will travel through the bicuspid valve and then travel into the left ventricle. And then after the left ventricle contracts, they will travel through the aortic valve right here, travel up here, behind there, and go into the aorta. So the aorta will so the upper part of the aorta will take blood to the upper part of the body, and then the lower part of the aorta will take blood to the lower part of the body. I can also check too. Does the upper aorta take blood exclusively to the upper because I might, but I don't know if it does. It doesn't exclusively. Okay. It's just all parts of the body, but yeah, the aortic arch, that's what I mean. So like this aortic arch, like it'll support the aorta in total, so this entire thing, can't really see it because it's behind there, but the aortic arch, this is your arch right here, that will take it to the upper parts of your body, so like your arms, your head, all that. And then this descending aorta here will take it to the lower parts of your body. And then your inferior vena cava will take that blood, or that deoxygenated blood from the lower parts of your body back into the heart. This will take it from the upper parts of your body back into the superior vena cava. And then the cycle will start again of reoxygenating the blood. Okay.